Hello, Neurodivergent Nation. This is Dr. Service, and I am at the beautiful Olympic Peninsula in Washington State at Kalaleck Beach. It's gorgeous out here. You can see all these sunbursts coming through the cool trees here. But I want to talk today about something that has to do with this, which is autistic burnout. The world doesn't understand or respect autistic burnout. And autistic burnout often looks like temporary cognitive decline, emotional dysregulation, and physical exhaustion. In other words, an autistic person's not thinking, feeling, or behaving very well when they're burned out. Raymaker and colleagues, they described autistic burnout as chronic exhaustion, loss of skills, and reduced tolerance to stimulus. There are some general differences, though, between autistic burnout and the regular type of burnout that most neurotypical people experience. Neurotypical burnout, it can look like emotional and social detachment and fatigue and exhaustion, feelings of professional ineffectiveness, lack of accomplishment, cynicism, and pessimism. Common reasons neurotypical people reach a state of burnout include trying to reach impossible deadlines, having rude coworkers, clients, or customers, or experiencing the chronic emotions of long-term caregiving. So that's the neurotypical burnout. Let me talk about autistic burnout and how that's different. In addition to what the neurotypical person might feel for burnout, it can also result in autistic people a decline or total loss of certain abilities, such as talking or walking or performing tasks at work, which can be temporary, or it can go on for long periods of time. It can also result in suicidal thoughts and actions. So it's not that they're just tired and exhausted and they need a break and a little self-care will do the trick. They seriously can't perform some functions as they could before until they take the steps to recover. Again, this is not all autistic folks, I always want to say that, but enough to where this is an issue. Unlike neurotypical reasons for burnout, autistic burnout can occur because of constant masking or camouflaging, constantly trying to meet challenging social demands, repressing stimming behaviors, tough life transitions, and pushing oneself beyond the limits for long periods of time without the ability to get relief from the stressors and masking. So basically, the expectations on them are greater than their ability to meet them. So speaking of masking, to understand autistic burnout, you've also got to understand masking. Masking is also known as camouflaging. It's the act of trying to pass as neurotypical by mimicking the behaviors and communication styles and skills of neurotypical individuals. This often means suppressing stimming behaviors. It means being hypervigilant to the social behaviors of others or forcing oneself to make eye contact. Autistic burnout might look very different with different age groups and developmental levels also. So what does burnout look like in autistic children? Burnout can often look like recurring meltdowns or shutdowns. It's a regression of skills and behaviors possibly, and gastrointestinal problems are really common. It's plausible that children find it easier and more comforting to regress to functioning from an earlier age than deal with the stressors in their current lives. In teens and adults, and in addition to the meltdowns and shutdowns, they may experience a reluctance or refusal to do things they did before, such as going to school or work. And they may also feel extreme fear and anger and depression and anxiety and possibly apathy, which can be difficult to identify when they just stop caring. They can also have flattened emotions and may appear expressionless. They may also experience physical symptoms such as nausea and headaches and body aches and even fever, among other symptoms. So every individual, as they get older and as life goes on, the demands increase in their lives, but with age, their brains also age, and as we know, an aging brain decreases the ability to adapt quickly, and they can produce less of those feel-good chemicals that we rely on. This is important for older autistic people. They may find themselves losing patience and being less able or less willing to mask. In addition to the stressors and the constant masking, many people are overstressed and they find themselves sleep deprived. So guess what? Sleep deprivation, it can also be a fast track to burnout. And I'll tell you right now that the most sleep deprived people I know are teenagers and stressed out adults. Teens tend to stay up late because biologically that's what teen body does, but the neurotypical world demands that they wake up before the butt crack of dawn to attend needlessly early school start times. And heaven help them if they attend a zero-period class or attend a religious seminary class. If I had my way, religious leaders in school districts would wake up to the fact that they're doing a disservice to their teens by offering or requiring these pre-dawn early morning starts. Guess what else leads to autistic burnout? relationship problems. And who tends to have differences in relationship patterns and concepts than the rest of the people in society? Neurodivergent people do. So they can be more at risk for burnout than the average person due to relationship issues. Finally, medical problems can really increase the likelihood of burnout as well. It's estimated that up to 85% of autistic people have gastrointestinal problems. I've already mentioned it twice. This is a thing, and it's a thing I struggle with, and I can tell you it takes a toll on the body and mind, and it prevents me from getting a good night's sleep sometimes, and some medications for this can increase anxiety levels, and that's only speaking of stomach problems. Other common problems that are medically related for autistic individuals include food allergies and seizure disorders and skin problems and headaches and asthma, immune system disorders, and so many more. But wait, there's more. What really sucks here is that the chronic conditions that lead to burnout can cause permanent changes to the brain. Not always, but it can. Which prompts the question, can a person really recover once they've reached the point of burnout? Not sure, but the most likely answer is for some yes and for some no. Every autistic person is different, so we can't make sweeping statements about these things. But generally speaking, there can be a full recovery, but for some, there can also be long-term consequences to autistic burnout. So let's shift gears now and work on identifying the signs you might see before autistic burnout occurs, then what we can do to prevent autistic burnout, and finally how to recover as quickly as possible. Let's go down to the beach for this next part. Okay, so here I am on the beach. It's gorgeous Kalaloch again, Olympic National Park. I'm not being paid to promote this. But anyway, these are some of the signs that you may be headed for autistic burnout. Well, number one, when executive functioning becomes impaired, such as having more trouble making decisions, more memory issues, or becoming more disorganized. This can include disorganized speech as well. Number two, when you're extra sensitive to sensory things. Number three, when your autistic traits and your behaviors start to become more pronounced, or you notice that you're having to mask more heavily than usual. Number four, when you start feeling body aches, like pains, and you start having headaches, that's another sign to watch out for. Number five, when you start to feel hopeless and helpless. Number six, feeling like you're going to melt down or shut down, or your meltdowns or shutdowns become more frequent. Number seven, if the desire to escape happens more than usual. I mean, normally, yeah, a lot of people say, I just want to escape, but if it's really ramping up, then that's a sign. Number eight, personal hygiene. When that starts to slip and self-care is not being practiced, watch out for that. Number nine, decreases in the amount of desire that you have to be socially active, which can be zero if you barely want to anyway. Number 10, when you start to notice that you're getting that foggy brain feeling, and if you've had it, maybe you know what I'm talking about. It's tough to describe, but brain fog is a good description. Number 11, if you're starting to feel more exhausted than usual. Number 12, and your desire to get up and start feeling the things that you need to do or want to do is diminishing or is gone. We call that activation. If you find that just completely out the window, that's a problem. So those are some of the signs that autistic burnout may be right around the corner, and you may want to take steps to immediately stop it. Of course, this list and every other list that I say, it's not an exhaustive list or explanation. So please add your own to the list that are true for you or someone you know. Now, emergency burnout, 911 response, how to stop burnout from continuing once it's started. Number one, the first step is immediately change your environment. This is the most important strategy in my opinion. Oftentimes, environment is a major contributing factor to burnout. If you're feeling burned out, get out. Go somewhere else where you feel better doing things that make you feel better, even if it means retreating and resting someplace that you're feeling safe and respected. Number two, hydrotherapy. This is a good one, but don't let its simplicity throw you off. It's very simple. Take a cold shower. Seriously, I'm not kidding here. Studies show that a 68-degree shower can have almost immediate effects to help you produce feel-good neurochemicals in the brain that will counteract a lot of burnout symptoms. Out here, it's actually colder than 68 degrees. So I know once you get in a warm water and then you turn it to 68, it feels really cold, but it really helps. So warm water, that can help too, but it's not as effective, I don't think. If you can take a shower do that. If you can't, splash cold water on your face, put a cold washcloth on the back of your neck, but try not to cut corners. Try to take cold showers each day while you're feeling down. It really does help. I know this from experience too. Number 3, deep breathing. It helps a lot also. Again, yes, it can seem cliche, but it's cliche for a reason. It actually works. Deep diaphragmatic breathing, look it up on Google. You can even practice sequential breathing. Number 4, got an emotional support animal? Well, pet it, hug it, love it, call it George. Old school people will recognize that one. That can really help as well. So emotional support animals are a good thing. Number 5, exercise and yoga. I'm not kidding about this either. This is probably just as or almost as important as the first one, which is environmental. Exercise and yoga are both amazing ways to come out of burnout. The secret of yoga, in addition to the physical benefits, is the mindfulness effect it has on you. So exercise has been shown to immediately change a person's emotional and physical state. So don't half-ass it though. Like really get in there and get your blood pumping and get those neuropeptides flooding your brain with feel-good chemicals. Burnout first aid, how to recover from it. Okay, so once you've stopped yourself from actively crashing and burning, it's time to take steps to recover. Number 1, the most important part of recovery is rest to reset. Resting to reset is different than just resting or laying around and not doing anything. Resting to reset, it actually means allowing yourself to get restful sleep, which usually includes less screen time, as much as that might drive you crazy. It means allowing others to serve you. And it means engaging in some restful activities like yoga, again, allowing your body to move and flex and stretch and get some natural light and sun. Take some cleansing baths and showers. Say no to things that you just shouldn't be doing while recovering, like commitments or meetings and other expectations that might take you in the wrong direction. So take care of yourself. Number 2, get out into nature. Throughout history, people have used the woods, the rivers, and the streams, the rolling hills to their benefit. Beethoven, we all know him, right? Well, first of all, it is speculated that he was autistic. But aside from that fact, he was very inspired by trees and rocks. Nikola Tesla, also speculated as being autistic, but he envisioned the electric motor while he was taking a walk through nature. The latest research all points to being in nature is something our brain needs. It needs to heal from not being in nature, the crazy world we live in. Countries around the world prescribe forest healing programs and ecotherapeutic programs as treatment modalities for mental illness that significantly improve the lives of those who suffer from everything from PTSD to ADHD. It's not about going out and just doing something nice in nature. No, it's actually a proven thing that will improve creativity and mood and makes neurological differences in the brain. So recovering from burnout must include as much nature as possible. How about how to prevent autistic burnout? My number 1 rule is honor your autism. This means accepting that your autism traits are something that's a part of you. Don't deny yourself those traits. Try to embrace them. If you need to stim away. If you melt down, then that's your brain and body basically demanding that you take time away from the stressors, or you'll reach a state of what? Burnout. So if you have special interest, even if others don't like that you have them, take time to indulge yourself in them. If you need to question people about something going on to feel better, well, screw how they feel, ask away. Watch out for sensory overstimulation in your environment and try not to just put up with it. Get out if something's bothering you. And if people don't understand, you can help them understand later, but right now the idea is to get out of the moment. So if they don't want to give you like the chance to explain later, well then they aren't that great of a friend anyway. So if you need to make a checklist and make schedules and routines, do it. Reach out to those who do understand you best and talk with them. When you're feeling down, it's okay to do that. And a true friend will honor your autism and needs as well. Finally, don't see yourself as flawed. Honor yourself. Number 2, know yourself, which means know your triggers. Know what your body's responses and reactions are. A lot of people, they're not aware of their own triggers, or the people who are often with them aren't aware of them. So write a list of triggers and add to that list as you experience them or think of more. And this is an ongoing list that should be shared with the person who might be able to help you if you start experiencing too many triggers at once. A lot of people do okay with 1 trigger. 2 triggers, it starts to be tough. 3, it's getting kind of rocky there. 4, now we're approaching the point of a meltdown. Number 5 or above, you have that many triggers, the train's already left the station. By the way, I talk a lot in metaphors, which is hilarious, right? I try not to, but what that means is once your emotional meltdown begins, it's tough to stop that. So knowing your triggers is vital. Number 3, create accommodations for yourself. If you were in school, they'd be required to accommodate your needs. So why wouldn't you accommodate your own needs outside of school? It's imperative that you write out some accommodations for yourself that you need in order to do well in life. It could be along the lines of, I get to take frequent breaks throughout the day when I'm working on something that's difficult for me. I'm allowed to hire someone to do the things that will ruin my day if I do them. I am not to hang out with so-and-so because I shared with her some of my insecurities and was vulnerable with her, and she used that against me later, so she's out. Number 4, get accommodations at work. You can ask for accommodations, and most any employer will be happy to help you. They want you to make them money, and if you can't function, you can't make them money. So ask for a stand-up desk, ask for space that has lights that can be dimmable, ask to be placed away from the area of the bathroom because you can't handle the smells. I wouldn't want that either way. Ask to work from home on occasion. All those things are things you should be considering. Well, whatever works for you anyway. Number 5, carefully plan where you go and have an escape plan. If it means you feel better to know what to expect, take the time and the effort to plan out as well as you can the event that you're attending. If you can't, do the best you can and have some backup plans and alternative moves already thought of. So have someone help you if you can't get the planning going. So let's say you're taking a motorcycle trip with your wife. Plan out the road ahead of time, know where the rest stops are, know where the restaurants will be and what the restaurants are along the way and what foods they serve. Have a couple options in each city you visit in case you don't feel like burgers and would rather have Italian. Also, when you're attending an event, have an escape plan. If you're like me, when I have to attend an event, I hate saying goodbye to everyone. They all want hugs and they want to tell me how nice it was to see me, which is fine, but it just makes me uncomfortable. So when I drop in, I make my rounds so everybody knows I was there, then I sneak out the back and slip away into the night. Now, if you want to leave and you need a reason, text your partner or friend that it's time to go and let them tell everyone that you two have to get going for whatever reason you've come up with ahead of time. Number 6, get others on board with your needs and have them watch your signs. So meet with those who you spend the most time with and specifically fill them in on what your needs look like when you're starting to feel overwhelmed. They can watch for signs in you that you're starting to get overwhelmed, and they can look for quick outs in every situation. This is important because often you may not recognize your own signs, so it's good to have someone else watching for you. Okay. If you have other suggestions, please let me know because I'm sharing my experiences and tens of thousands of hours of experience with you in working with autistic people. So please share your insights with me as well so I can pass those along. Much love to you all, and I hope this helps you in your neurodiverse universe.